Hi, and welcome back for Thyroid Success Secret number 4. In Thyroid Success Secret number 3, we talked about thyroid antibodies needing to be done to determine if you have an autoimmune thyroid condition called Hashimoto's thyroiditis. And we talked about thyroid peroxidase antibodies and thyroglobulin antibodies. So in that Thyroid Success Secret, I also explained that for some people, if they're Th1 dominant, they may not be able to produce antibodies in the first place. So they may go for their thyroid antibody tests and the tests come back negative, and so the doctor says you don't have an autoimmune thyroid condition. Yet your TSH levels continue to fluctuate up and down, the medications don't seem to work, your symptoms don't go away with thyroid medication, so you're thinking something else is wrong. So how do you know if you have an autoimmune thyroid condition even if your thyroid antibodies are negative? Well, we can look for some other clues. And the first clue is that you already have some other autoimmune condition. If you have celiac disease or colitis or rheumatoid arthritis or psoriasis or some other autoimmune condition, it's a pretty good bet that your thyroid symptoms are probably the cause of Hashimoto's. Since Hashimoto's is the most common autoimmune condition in the United States, if you have other autoimmune conditions, the likelihood is that you probably have an autoimmune thyroid condition. So there's other clues that we can look at to determine if you may be autoimmune thyroid, even if your thyroid antibodies are negative. And one of those is that your symptoms wax and wane. If your symptoms seem to come and go, your TSH levels seem to go up and down, if your medication dosages need to kind of go up and your doctor has to increase them and decrease them, it's a pretty good indication that you probably have autoimmune thyroid. If you take thyroid hormones and your symptoms still don't go away, it's a pretty good indication that you may have autoimmune thyroid. Another indication that you may be autoimmune thyroid is when I see a patient and they're taking lots and lots of supplements to try and make themselves healthy and well. To me, that's usually a pretty good indication that they're struggling with an autoimmune thyroid condition. And many times my patients come in with bags of supplements they've tried, and they're taking lots and lots of medications or supplements just to try and stay well. It's usually a pretty good indication to me this is a person who's autoimmune. And then the last thing that usually for me is an indicator that they may be autoimmune thyroid is that everything kind of started after a trigger. Maybe it was their second pregnancy, maybe there was a stressful event, but some stressor occurred, and then everything seemed to go downhill after that. And now you've been to doctor after doctor after doctor, and nobody seems to know what's going on, or they look at you like you're crazy, or you have the symptoms but they can't find anything wrong, or you have the symptoms and your labs are normal. That to me is a pretty good indication that they're autoimmune. And I like to think that somebody's probably autoimmune until we can prove otherwise. So that's Thyroid Success Secret number 4. Stay tuned for Thyroid Success Secret number 5. If you have some questions and you want some answers and you're looking for some immediate help, pick up the phone, call my office, 610-558-8920, and ask for your thyroid discovery visits. All right, take care.